In reflecting upon the past 100 years of mental health in America, 3 books came to my mind. The first is Clifford Beer's memoir, A Mind That Found Itself, published in 1907. And I'd like to read to you a brief excerpt from the book. Quote, "No incidents of my life have ever impressed themselves more indelibly upon my memory than those of my first night in a straitjacket. Within 1 hour of the time I was in it, I was suffering pain as intense as any I ever endured. And before the night had passed, it had become almost unbearable. My right hand was so held that the tip of one of my fingers was all but cut by the nail of another, and soon knife-like pains began to shoot through my right arm as far as the shoulder. After 4 or 5 hours, the excess of pain rendered me partially insensible to it, but for 15 consecutive hours I remained in that instrument of torture, and not until the 12th hour, about breakfast time the next morning, did an attendant so much as loosen a cord." Beers explains that it wasn't really necessary to have the straitjacket that tight, that it could have been loosened so it would have been just restrictive and not excruciatingly painful. But the attendant chose to tighten it so that it became an instrument of torture. Beers, of course, as has been mentioned, proceeded with others to found the National Committee on Mental Hygiene, whose centennial we're celebrating today. The second book I wanted to mention also relates to World War II. We heard from Richard Nakamura about the impact of World War II in helping us to recognize the general needs of the population in mental health and helping to get the NIMH founded. There's another aspect of World War II I wanted to mention, reflected in this book called The Turning Point by Alex Sarayan, published in 1994 by American Psychiatric Press. This book chronicles the role of conscientious objectors during World War II in helping to publicize the conditions in state mental institutions. At the time, most of the regular attendants in the institutions joined the military. Members of the Quaker, Amish, and Mennonite religions replaced those attendants as an alternative to their own military service. These conscientious objectors were appalled at the conditions they discovered and at the customary use of violence to control the behavior of residents in the institutions. And the conscientious objectors set about to draw attention to the mistreatment and to institute reforms. In 1946, as a result of their efforts, major exposés of the conditions were published in Life magazine and Reader's Digest. Interesting, the same year as the founding of NIMH. And the conscientious objectors formed a national lay organization called the National Mental Health Foundation. In 1950, this organization joined with the Psychiatric Foundation and the National Committee for Mental Hygiene, Clifford Beer's organization, to form the National Association for Mental Health. The third book I wanted to mention is Judy Chamberlain's On Our Own, published in 1978. This book describes what was at that time a fledgling grassroots mental health consumer movement predicated on the principles of recovery, empowerment, self-help, and advocacy. I myself read Judy's book as a graduate student in about 1980, and I sought her out. She introduced me to a number of people involved in the movement at that time. Activities of the consumer groups at that time included demonstrating outside the annual convention of the American Psychiatric Association, forming a human chain to try to prevent psychiatrists from attending the meeting. They weren't very successful in preventing them from attending. How far we have come since Clifford Beer's day, and how far we have yet to go. Today, at the Center for Mental Health Services, mental health consumers have a seat at the table as an integral part of our policy development and program management, no longer relegated to demonstrating outside the door. And still we have mountains to climb to improve the effectiveness and availability of services, to understand how best to promote mental health and recovery, and to alleviate prejudice and discrimination toward people who have mental health problems. In forebears like Clifford Beer's, the World War II conscientious objectors, and Judy Chamberlain, we see the inspiration to scale these mountains and collectively to find our path forward.